Welcome to another deep dive.
Yeah.
Today we're going to be looking at canine spinal ependymomas.
Sounds pretty intense.
It is. It's fascinating, though.
Nah.
And we've got a great study here from the Journal of Small Animal Practice.
Always a good source.
Yeah. So this one really digs into diagnosis and treatment of this particular type of spinal tumor.
Spinal tumors, I mean, they're already rare.
Yeah.
So this is like rare of the rare.
Exactly.
Yeah.
So, when we talk about ependymomas, I think it's helpful just to level set for everyone.
Yeah. What are we even talking about?
Exactly. So these tumors, they come from the cells that line the central canal of the spinal cord.
Okay.
And they can cause a whole bunch of different neurological symptoms.
Right. And they're tough to diagnose a lot of times,
Right. You need advanced imaging to really get a clear picture.
For sure.
So this study looked at 8 dogs that were diagnosed with spinal ependymomas.
Okay.
And I think to start off, it's always helpful to get a sense of what kind of dogs are we talking about here? Like, were there certain breeds that were more likely to be affected?
Right.
Were there any age patterns or, male versus female? Was there any sort of trend like that?
Yeah. So it was really interesting. They had a mix of breeds, I remember there was a French bulldog, a poodle, a Labrador retriever.
Okay, a good mix.
Yeah. And then a few mixed breeds, too.
Okay, so a pretty diverse group there.
Yeah, it really was.
And as far as the sex of the dogs, did they notice any kind of pattern there?
No, not really. It seemed pretty evenly split between males and females.
Okay, interesting.
But age was something that kind of stood out to me. They ranged in age from 2 to 10 years old.
Oh, wow. So really across the spectrum?
Yeah, pretty much.
Yeah.
I mean, that suggests that, this condition, it can affect dogs at, pretty much any point in their life.
Right. That's something to keep in mind, right?
Absolutely.
So it's not just something that affects, older dogs or anything like that. So let's talk about the way these tumors actually presented. Like, how are they initially suspected?
Right. So, the dogs that were included in the study, they had a whole range of different neurological signs.
Okay.
And even the time it took for those signs to develop that varied too. Some of them, it was really acute. It happened within like 48 hours.
Oh, wow.
Yeah. But then others, it was much more gradual. It took weeks or even months for the signs to become really apparent.
Okay. So pretty variable presentation there.
Yeah, exactly.
So when you say neurological signs, what specific things were the dogs actually exhibiting?
So the most common ones were paraparesis or tetraparesis.
Okay. I'm going to need a little bit more explanation on those.
Sure. So basically paraparesis means weakness or paralysis of the hind limbs.
Okay.
And tetraparesis is the same thing, but it affects all 4 limbs.
Okay.
So, they might have trouble walking or they might be completely unable to walk depending on the severity. And then on top of that, a lot of them showed ataxia, which is basically a lack of coordination.
Okay.
They might stumble around or have trouble keeping their balance.
Right.
And then the thing that really surprised me was that some of the dogs actually showed signs of spinal pain.
Spinal pain. That's
Right.
interesting. Because I always thought that, these kinds of tumors, especially the ones that are located within the spinal cord, like the intramedullary tumors,
Right.
those weren't typically painful.
Yeah, that's kind of the general thinking. But,
Yeah.
this study actually challenges that assumption because out of the 8 dogs, 4 of them did show signs of pain.
Oh, wow. That's pretty significant.
Yeah, it really is. It just goes to show that we can't rule out spinal pain in these cases, even if it's not, what we typically expect.
Right. So important for vets to be aware of that.
Yeah, for sure.
So we've talked about, how these tumors presented clinically, but how were they definitively diagnosed?
Okay. So the gold standard here is really magnetic resonance imaging.
MRI.
Okay.
It's-
That's real. Yeah. You need that detailed imaging to really see what's going on in the spinal cord.
For sure. So can you walk us through, what the typical MRI findings are for a canine spinal ependymoma?
Yeah, absolutely. So in all 8 of the dogs in this study, the tumors, they showed up on the MRI as these intramedullary lesions.
Okay.
And they had this kind of oval shape to them.
Okay.
And one thing that was consistent across all the cases was that they were hyperintense on the T2-weighted images.
Hyperintense, meaning they were brighter than the surrounding tissue.
Yeah, exactly.
Oh.
And then on the T1-weighted images, they were isointense to the spinal cord. So that means they had a pretty similar signal intensity.
Okay.
But when they used contrast enhancement, the lesions really lit up.
Oh, wow. So they showed a marked increase in signal.
Right.
Interesting. So those findings were pretty consistent across all the cases.
Yeah, they were.
But Were there any like unique or unexpected observations on the MRIs?
There was one thing that really stood out to me.
Okay.
3 of the dogs, they had what's called a hemosiderin cap sign.
A hemosiderin cap sign. I've never heard of that.
Yeah, it's not something you see every day. So it's basically this hypointense rim around the tumor.
Hypointense meaning darker.
Right.
Okay.
And it shows up on both the T2 and T1-weighted images.
Interesting. And what does that tell us?
So it suggests that there's hemosiderin present, which is a breakdown product of blood.
Oh, okay.
So it basically means that there was some bleeding within the tumor at some point.
So a history of bleeding within these tumors, is that commonly seen?
That's what's so interesting about it. You know, this hemosiderin cap sign, it's been reported in human ependymomas.
Okay.
But it's not really something that's been widely documented in veterinary medicine.
Oh, wow. So this study could be, highlighting a new diagnostic clue for vets.
Yeah, exactly. And to make things even more interesting, one of the dogs actually had visible evidence of hematomyelia on the MRI.
Hematomyelia.
So that's bleeding within the spinal cord itself.
Oh, wow.
So, that kind of backs up the idea that bleeding can occur with these tumors, even if it's not always super obvious.
Right. And it sounds like even with, less advanced imaging equipment, these findings were still visible.
Yeah. The study mentions that these signs were visible even on low-field MRI.
Wow. That's pretty remarkable.
Yeah. It means that even vets who don't have access to, the most high-tech equipment, they can still potentially detect these characteristic signs.
Right, which could lead to earlier and more accurate diagnoses.
Exactly.
That's huge. So let's talk about treatment now. What were the initial steps that were taken to try to manage these ependymomas?
Well, in most of the cases, they started with immunosuppressive therapy.
Okay, so trying to control the inflammation around the tumor.
Right.
Did that prove to be successful?
Unfortunately not. In this study, at least, immunosuppressive therapy wasn't successful in any of the cases.
Oh, wow. So they had to move on to other options.
Yeah.
What were those?
So 5 of the 8 dogs ended up having surgery.
Okay, to try to remove the tumor. I mean, that sounds incredibly delicate considering where these tumors are located.
Yeah, it is. They actually emphasized the use of a surgical microscope in this study.
Oh, okay.
Because it allows for much more precise tumor removal. You can really minimize the disruption to the surrounding spinal cord tissue.
That makes sense. So what about after surgery? What were the outcomes like?
So most of the dogs, they did experience some neurological deterioration immediately after surgery.
Oh, that's understandable, I guess.
Yeah, which makes sense given, how invasive the procedure is.
Right. But hopefully it was temporary.
Yeah. Thankfully it was. All of the dogs showed some improvement within the first week after surgery.
Okay, that's encouraging.
Yeah.
Were there any cases where, the dogs had particularly impressive long-term outcomes?
There were actually 2 cases that really stood out to me. One dog survived for 12 months after surgery.
Wow.
And another one lived for an incredible 18 months.
That's amazing.
Yeah.
Especially considering, these tumors are often considered pretty aggressive.
I know. It's really remarkable. It makes you wonder what was different about those cases.
Right. Were there specific factors that contributed to their success?
That's the million-dollar question. Was it something about the tumors themselves, the surgical approach, or maybe something else entirely that we haven't even considered yet?
It seems like there's still a lot to learn.
Definitely.
So before we move on to the next part of our deep dive, let's touch on the histopathology.
Okay.
The microscopic examination of these tumors. What did that reveal?
Well, it confirmed the diagnosis of ependymoma in all 8 cases.
Okay.
But there were some variations in the subtypes that were identified.
Okay, so what were the different subtypes and what's the significance of that?
So they found cellular anaplastic and papillarity subtypes.
Okay.
And these subtypes, they're based on the microscopic appearance of the tumor cells.
Okay.
And they can sometimes give us clues about how the tumor might behave, its growth potential and things like that.
So even within this category of ependymomas, there's still some diversity.
Yeah, absolutely.
And were all of the tumors confined to the spinal cord?
In one case, there was actually evidence of CSF spread.
CSF spread. So the tumor is spread beyond the spinal cord.
Yeah. So CSF stands for cerebral spinal fluid. It's the fluid that surrounds the brain and spinal cord.
Okay.
And in this case, there were tumor cells present in that fluid.
Oh, wow.
Yeah.
So that raises concerns about potential metastasis.
Yeah, exactly. It just highlights how important it is to assess the entire central nervous system.
Right, because the tumor might not always be limited to that initial spot where it was detected.
Right.
That's really important information for guiding treatment and prognosis. So I think this is a good place to pause for now.
Okay.
And we can delve deeper into the implications of these findings in part 2 of our deep dive.
Sounds good. So welcome back to our deep dive into canine spinal ependymomas. We've covered a lot of ground already. We've talked about the clinical presentation, the diagnostic findings, and the initial treatment approaches.
We have. And it's really fascinating stuff. But I think now we need to zoom out a little bit, and talk about the broader implications of this study.
Okay.
Like, what does this mean for veterinary practice?
Right.
You mentioned earlier that the study really highlights the importance of recognizing specific MRI features, particularly that hemosiderin cap sign.
Right.
Could you talk a little bit more about why that's so significant?
Yeah, absolutely. So that hemosiderin cap sign, that hypointense rim that we talked about,
Right.
that indicates previous hemorrhage.
Right.
And that really acts as like a red flag for vets.
Okay.
So even in cases where, the other MRI findings maybe aren't completely classic for an ependymoma,
Right.
if you see that hemosiderin cap sign, I really got to think about that diagnosis.
So it could be instrumental in early detection.
Exactly. And that's really the key here.
Yeah.
The earlier you can diagnose it,
Right.
the better the chances of a good outcome.
Absolutely. And speaking of intervention, the study also suggests that surgical removal can actually offer significant improvement.
Yeah.
In terms of neurological function and potentially extending survival time.
Right.
Especially when it's done with the surgical microscope.
Yeah, the surgical microscope, it makes a huge difference.
Right.
It allows for such precision.
Yeah.
You can really minimize the damage to the surrounding spinal cord tissue.
Right. So less collateral damage during surgery should translate to better recovery.
Exactly. And while, this study alone can't definitively prove that the results are definitely promising, it warrants more investigation for sure.
Absolutely. So this brings us to the question of radiotherapy.
Okay.
In human medicine, radiotherapy is often used in conjunction with surgery for ependymomas.
Right.
What about in veterinary medicine? What's the current thinking there?
Yeah, that's the burning question. Radiotherapy wasn't specifically looked at in this study.
Right.
But it definitely highlights the need for more research in this area. We need to figure out if radiotherapy can actually improve outcomes for dogs with spinal ependymomas.
Right.
Whether it's used alone or alongside surgery.
So a potential avenue for future research.
Absolutely.
Are there any other big unanswered questions that this study kind of raises?
Yeah, definitely. Those two cases with the really long survival times?
Right, the 12 and 18 months?
Yeah, what made those dogs different?
Right.
Were there specific, genetic or molecular factors within those tumors that made them respond so well to treatment? Was it something about the surgical approach?
Right. Were there subtle differences that we just haven't picked up on yet?
Exactly. These are the million-dollar questions.
Yeah, and the answers could really change the way we approach these cases.
For sure.
So this study also touched on the issue of pain management.
Okay.
You mentioned earlier that some of the dogs actually presented with signs of pain.
Right.
How can we best address that pain in dogs with spinal ependymomas, both before and after surgery?
Yeah, that's a really important consideration. Adequate pain relief. It's crucial, not just for the dog's comfort, but also for their overall well-being and their recovery.
Of course.
So we need to explore a multimodal approach to pain management.
Okay.
Tailoring our strategies to each individual patient.
So it's really a combination of art and science.
Exactly.
You've got to have that scientific understanding of pain pathways and pharmacology.
Right.
But you also need that compassion.
Yeah.
That understanding of what the patient's actually experiencing.
Absolutely.
Now, this study specifically focused on spinal ependymomas. But how do these tumors compare to, ependymomas that are found in the brain?
Yeah, that's an important distinction. While they share some similarities, spinal and intracranial ependymomas, they do have their own unique characteristics and clinical implications.
So what are some of the key differences?
The spinal ependymomas, they primarily affect the spinal cord, which leads to, those neurological symptoms that we talked about.
Right, the weakness, paralysis, coordination problems.
Exactly. Intracranial ependymomas, on the other hand, they originate in the brain.
Okay.
And their symptoms, they really depend on where the tumor is located.
Okay.
They can affect vision behavior. They can even cause seizures.
Wow. So the location really dictates the clinical presentation.
It does. And it also influences the treatment options.
How so?
Well, surgically accessing a tumor in the brain, that's a lot more complex than operating on the spinal cord.
Right. There are a lot more anatomical challenges.
Exactly.
So while this study gives us some really valuable insights into spinal ependymomas, it's important to remember that ependymomas as a whole
Yeah.
They're very diverse.
Absolutely.
And there's still a lot we don't know.
For sure.
So it really underscores the need for continued research
Yeah.
and collaboration among veterinary specialists.
Oh.
To further our understanding and improve our management of these complex tumors.
Right.
Now let's shift gears a little bit and talk about the human side of this equation.
Okay.
Because getting a diagnosis of a spinal tumor in your dog,
Yeah.
that can be incredibly emotional.
It can be really tough.
What advice would you give to pet owners who are facing this situation?
Well, first and foremost, I would say talk to your vet.
Okay.
Openly and honestly.
Yeah.
Don't be afraid to ask questions.
Right.
Voice your concerns.
Yeah.
And seek clarification on anything you don't understand.
Knowledge is power, especially in these situations.
Absolutely. And, remember, you're not alone.
Right.
There are support groups out there,
Yeah.
online communities where you can connect with other pet owners who are going through the same thing.
Sharing experiences and finding strength in that community can make a huge difference.
It really can. And, never underestimate the power of your love and support for your dog.
Yeah.
Even in the face of adversity. The human-animal bond can be incredibly powerful.
Absolutely. So I think this is a good place to transition to the final part of our deep dive.
Okay.
Where we'll explore the future directions of research.
Right.
And what lies ahead for dogs that are diagnosed with spinal ependymomas.
Sounds good.
Welcome back to the final part of our deep dive on canine spinal ependymomas. And, we've covered a lot of ground in this deep dive.
We have.
From diagnosis and treatment all the way to, the emotional aspects of caring for a dog with this condition.
It's been quite a journey.
It has.
Yeah.
And as with any deep dive,
Yeah.
we surface with more questions than answers.
Right. Which is always how it goes.
I know. It's challenging, but it's also exciting, right?
Yeah, definitely.
Yeah.
It keeps things interesting.
It does. So where do we go from here? What are some of the big unknowns that need further investigation?
Well, like we talked about before, the role of radiotherapy.
Right.
That's a key area for future research.
Yeah. We need to figure out, how effective it really is in treating these tumors.
Right.
Whether it's used on its own or in combination with surgery.
Exactly. And then there's the question of dosing and timing.
Right.
When's the best time to use it?
Yeah.
What's the optimal dose?
To get the best results without, causing any unnecessary harm.
Right, exactly.
And of course, we can't forget about those long-term survivors.
Yeah. Those cases are fascinating.
They really are. Those two dogs that lived for 12 and 18 months after surgery?
I know.
It makes you wonder what was different about them.
Yeah, was it something inherent to their tumors? Were there genetic factors at play?
Right. Or maybe it was something about the surgical approach.
Right. Maybe there were subtle differences in the way the surgery was performed.
That made all the difference.
Exactly.
Unraveling the reasons behind their success could really change the way we approach these cases in the future.
It could be a game changer.
And we also talked about the importance of pain management.
Yeah.
Several of the dogs in this study showed signs of pain. So we need to do more research to figure out the best ways to manage that pain.
Absolutely. Both before and after surgery.
Right. It's all about providing the best possible care and ensuring that these dogs are as comfortable as they can be.
Couldn't agree more.
So as we wrap up this deep dive on canine spinal ependymomas, what's the key takeaway message you want listeners to leave with?
I think the main thing is that these tumors are complex, but we're making progress. Advancements in imaging surgical techniques and our understanding of tumor biology, they're all giving us new possibilities.
Right. And early detection is so important.
It really is.
With skilled veterinary care and the support of their owners, even dogs facing this diagnosis can still have a good quality of life.
Absolutely. Never give up hope. From Vet Neuro Jar. Keep those minds-inspired hearts light and tails wagging.
Thanks for joining us on this deep dive. We'll see you next time.